So now I'm going to move on to the next part. I'm going to talk a little bit about the Save Lives Oregon initiative and provide you an update on that. So the Save Lives Oregon, Salvando Vidas Oregon initiative is a collaboration between OHA and a leadership team that is composed of community and tribally based organizations and whose members on our leadership team are experts in harm reduction, and they work across the continuum of substance use. The purpose of this initiative and the partners is to support agencies across Oregon to move from awareness of harm reduction to partnership in harm reduction efforts, and to provide equitable access to life-saving supplies and resources for organizations that directly serve people at the highest risk of overdose, infection, and injury due to substance use. So here is our partner organizations. So I want to kind of frame this with harm reduction strategies are critical elements of Oregon's substance use response. They are one part of several parts of the response, but the response centers around hope and healing and health for people, for families, and for communities. It involves justice reform and is all centered in equity and equitable access. So what Save Lives Oregon does is it helps fill this gap. If you think about this continuum of substance use from primary drug prevention to accessing substance use treatment on the two ends, in the middle is this harm reduction gap. And in this gap sits Save Lives Oregon and a lot of other direct service agencies that are helping people who are using substances, who are currently that with whom, without being in that gap, they would not have access to the skills and tools and knowledge that they would need to stay safe. So among many other organizations, Save Lives Oregon helps fill that gap. So I'm going to talk a little bit about the different kind of elements of Save Lives Oregon, Salvando Vidas Oregon initiative. So we have a website, and on that website, there are videos and community partner spotlights. There is a resource toolkit, communication resources and materials that will support agencies as they integrate harm reduction strategies. That includes things like posters and handouts and one-pagers, directions on how to use BTNX fentanyl test strips, for example, links to how to administer naloxone. All of these can be picked up by agencies and used to either help them integrate or to actually implement their harm reduction strategies. The initiative also provides support for agencies to move from awareness of harm reduction to action through capacity building, learning collaboratives, and technical assistance. So our learning collaboratives happen approximately once a month, and I have some information at the end of the presentation on the learning collaboratives. And then we will have, and what most people are more familiar with around Save Lives Oregon is the Harm Reduction Clearinghouse Project. And we also have, finally, lastly, special projects such as the School Opioid Overdose Reversal Kit Project. So looking at the Harm Reduction Clearinghouse Project specifically, eligible entities are those that directly are reaching out to people who are using drugs or at the highest risk for substance use related overdose, infection, and injury. And this includes community-based organizations, county behavioral and public health agencies that are providing direct service, harm reduction and syringe service programs, jails that provide naloxone and other harm reduction supplies at release, tribal community and healthcare programs, substance use disorder treatment programs, uniform first responder agencies that implement leave behind programs, and special district agencies. These are agencies that are in more rural areas, but that includes fire, EMS, hospitals and health centers, libraries, parks and recreation, ports, and even we have several transit agencies that distribute naloxone from their buses. So how do people join the clearinghouse? If you are not in the clearinghouse, this is the steps to get in. You have to apply. We have an online application form. We try to keep it very short. If you have any trouble, you can reach out to us. Once we receive an application, we look to make sure that the group applying is eligible. So are they someone that works directly with people who are using substances? Are they going to distribute supplies to people using substances? Are they a special district? Step 2, once an application is accepted, we do we start the account setup process. That can take up to 90 days to complete. But in the midst of that, what we do is we ask, do you need naloxone to help you bridge that setup process? And when an agency says yes, we send them what we call bridge naloxone. So when you sign up, you don't have to wait 90 days to access naloxone. You can access naloxone once your application is accepted. So step 3, after the account is set up, there's a training that teaches the person that's assigned to order supplies for the agency how to do that. And an agency can order. And the reason we have agencies ordering for themselves is that agencies come in all different sizes with all different amounts of storage space. And so we want to make sure that people are ordering the amount that they need to fit up the space that they need, that they're going to move fast out. We do not want things like naloxone expiring under people's desks or in people's closets. And so by allowing people to order over time, people can order what they need. So we ask that people report monthly the distribution of naloxone, syringes, sharps containers, and sites can voluntarily report overdose reversals that are reported to them. And then we provide ongoing technical assistance and support. People can ask questions about supplies, if people have ordering problems, if they need technical assistance, people can participate in, other activities. You don't have to be in the clearinghouse to attend a learning collaborative, but we do really like to have people that are ordering consider participating in our learning collaboratives, because a lot of them are focused around the delivery of harm reduction services. So I want to talk to you a little bit about the funding for Save Lives Oregon. So I said at the beginning that I wanted to talk to you a little bit about SOR, and that is because Oregon leverages the SAMHSA State Opioid Response Grant to support the website development and maintenance of components such as our community partner spotlights. And we have our harm reduction in action video series. We lean into SOR grant support to develop resources and materials, the posters and the pamphlets and the wallet cards, and then also to support the learning collaboratives. We do an annual survey. We have had focus groups and listening sessions to figure out how to make the initiative better and more responsive, and also the technical assistance. So there's a little bit of staff that's funded by the SOR that's dedicated to the clearinghouse. And then we also leverage SAMHSA block grant funds to support a second, a 1.0 staff person. So we have also leveraged funds from different sources to purchase the supplies, and that has included the Access to Care grants, general funds, and state level opioid settlement prevention, treatment, and recovery funds. So this has supported the supply purchasing and the special project supply purchases for the school opioid reversal kit project. So I want to give you some key metrics, and these key metrics are specific to January 1st because we wanted to track, go back and look very specifically about what we have been able to do with the opioid settlement, prevention, treatment, and recovery board funding as it relates to supply distribution. So key metrics from January 1st through October 28th, the Harm Reduction Clearinghouse distributed 297,258 doses of naloxone to participating agencies. Agencies can order a variety of other supplies, and we have bucketed them into these kind of broad spending categories. So naloxone is our biggest spending category. And next under naloxone are wound care, hygiene, safer use, and safer sex supplies. Down lower than that, we have sterile syringes and sharps containers. And then other supplies. Those other supplies include testing supplies. So hepatitis C, test kits, pregnancy test kits, other types of supplies. So also wanted to share that since January 1st of 2024, so January through October, we had approximately 8,000 opioid overdose reversals that were voluntarily reported to us by partner agencies. When we look back over the full course of the harm reduction clearinghouse, we have received over 20,000 overdose reversal reports that are voluntarily reported by partner agencies, but 8,000 in the past year. So the number of entities that have received supplies through the harm reduction clearinghouse, our highest number and is 164 community and tribal organizations and programs. We have 54 uniformed first responder agencies, 54 special districts, 49 syringe service program, harm reduction programs, 33 substance use disorder facilities, and 21 health clinics and emergency departments. So I had mentioned our one-time school overdose prevention kit project. So eligible schools in Oregon could receive up to 3 opioid overdose reversal kits. It was a red box, and in that box were 4 boxes of naloxone, so 8 doses. They could receive up to 3. We had 663 schools, colleges, universities, and school-based health centers from all over Oregon participate in this project. This project is still ongoing, so schools can still apply. And also, I neglected to mention that we don't have an application date. So we do rolling applications. So if you are an organization that provides direct service to people using substances and you are not in the clearinghouse and you want to distribute harm reduction supplies, please consider applying to participate in the clearinghouse. We don't have a grant deadline. It is a rolling application. So one of the questions that we get asked a lot is, does this project make any difference? Does this type of distribution of naloxone make any difference? So we were able to, through the SOR grant, access some technical assistance, and we met with a professor and doctor down in San Francisco. He is with UCSF and the San Francisco Department of Public Health. And he developed a modeling study where he modeled overdose and naloxone distribution in the setting of fentanyl compared to heroin. And so he was able to use his model to model Oregon's data along with what it would look like if the death rates would look like without naloxone access and with 80% of people who are at overdose risk having access to naloxone. So when you look at this chart, the bottom is the percentage of deaths attributed to fentanyl, and the top is the percentage of people who died from opioid overdose per year. So as fentanyl saturation increases, the green line, the red line is the line of what we would expect the death rate to look like if there was not naloxone access. The green line is what we would model and expect the death rate to look like when 80% of people at risk have naloxone. And these blue dots are Oregon's data, Oregon's percentage of persons who have died data plotted out against that. And so you want to be obviously below the red line, but you also want to be below the green line. And so what this shows is that the type of distribution that Oregon has done since COVID times has flattened what we would have expected to have seen in terms of death, and being, very transparent. all of these are people. And so our goal is to keep that number as low as possible. So the suggestion that we received as part of the technical assistance was to keep doing what we are doing. And that at this point, we should employ, with the saturation increasing, employing any intervention that has been shown to have evidence to decrease deaths. So I want to give you a little bit of supplemental information. So this is information, the materials and resources that are available to you through Save Lives Oregon, Salvando Vidas Oregon on the website. So we have print-ready posters and guides and tools. We have presentations for community partners that you can use in English and Spanish, all about naloxone and the basics of harm reduction. Community presentations. Please feel free, if you would like these decks, you can download them from the website. You can also send us an email and we can send them to you. Our goal is to have these out in the community, getting this information out as broadly as possible. We also have videos in English and Spanish on how to give naloxone and harm reduction in action. We were able to use some of our funding to feature partner organizations that are doing work in rural areas with the Latinx community and with Black African American community in Oregon. We also, I had mentioned monthly learning collaboratives. Here are some of the collaboratives that we've done this year. We do have a upcoming all about naloxone in English. That's going to be Thursday, December 12th from 1 to 2:30. What you need to do is you register and we'll send you the link. We also have, if you're interested in hearing from community partners, we have a community partner spotlights here. And that is all I have. So thank you very much for listening. And I hope this has been helpful. Feel free to reach out at info@savelivesoregon.org and we can connect you. Thank you.